Hi, I'm Dr. Rick Rieser. I'm one of the doctors that works in the clinic here, and I have a few things I want to tell to the new patients that come. But if you're an old patient and you've been around for a while and you've had recommendations before, then some of this information might still be interesting to you. The first thing I want to talk about is the three players in medical marijuana land. First is indica. Indica is a sedative, and it's a very good one. It's affectionately called in-the-bed, in-the-couch, indica. It's a sedative, and it works as a sedative in most people, not everybody. And what I want you to do, if you have insomnia, then this is the way you want to approach it. What you want to do is you want to first check to make sure all the doors and windows are closed. Then make sure the pathway to the bathroom is clear, because you're going to, in the middle of the night, if you need to use the bathroom, you're going to go zombie right into the bathroom and zombie right back to bed, and you're not even going to remember the experience. But if the pathway is not clear and you trip on something and you fall and hit your head, that you will remember. So clear the pathway between your bed and the bathroom, and then set the alarm. After you set the alarm, then you take out your indica pipe and you smoke just a few hits, and then as you're putting it down in the ashtray very, very carefully to make sure you don't burn the house down, then the next thing you know, it's morning and you're waking up to the alarm. Now that's a big claim, but it's not going to work in everybody, but it will work in most people. And in the beginning, you'll probably oversmoke, and it will be a surprise to you when the alarm goes off. But later on, you'll be taking just a half a hit and you'll be going right to sleep. Okay, that's indica. Sativa is more of a stimulant. It's an upper. It's more appropriately used right before you're going dancing, or going gardening, or going to the gym, or doing yoga. It's an upper, and it's a pretty good one. It gets your creative juices flowing. And then we have CBD. CBD is if in indica and sativa, the THC is way up here, and the CBD is way down here. But there's still some CBD in indica and sativa. But some wise people got some plants that grow mostly CBD and very little THC. And that was originally found to be profoundly effective in childhood epilepsy. It also works in some adults with epilepsy. Not everybody, but it does work with some. CBD also has a number of other effects that I want to share with you, especially when it comes to migraine headaches. Now, I've had three very powerful patients that spent a lot of time with me educating me about migraine headaches and CBD. Two of them said that 4 drops of CBD oil, and we're talking about run-of-the-mill CBD oil, there's a bunch of them out there on the market, that 4 drops a day is all it took to completely stop them from having migraine headaches. One guy was having 4 headaches a week, lasting up to 4 hours, with nausea and vomiting, the whole 9 yards, and he went down to 2 headaches a year. Another patient told me the same thing. As soon as he started the CBD oil, his migraine headaches went away. And then I had another person, a woman, who had been fighting with migraine headaches for 5 years, and instead of 4 tiny drops out of the thing, she would take a full column of oil in that eyedropper twice a day, and she said that it made the headaches more tolerable, but it didn't make them go away completely. Okay. At the end of the interview that you're going to have with the doctor, there's going to be a letter that he's going to sign, or I'm going to sign, and that letter is your ticket into the dispensaries. You cannot lose that letter. So what I want everybody to do is fold that letter up very neatly and tuck it away in your wallet to let it live in your wallet for the next year. That's your ticket into the dispensaries, and you can go to any dispensary in the state of California. You can't take it out of state. It won't apply in any other state. Okay, if you're planning to go to school, then high THC indicas and sativas might monkey muck around with your short-term memory. So I want you to be aware of that. You might want to learn how to use CBD. CBD is also very profound when it comes to pain control. It also works for anxiety. It also works for depression. It especially works for back pain. So if you're using marijuana for pain, then you want to learn about CBD, because you don't get high on it. You can drink the whole bottle and you're still not going to get high on it. Okay, if you most communities in California allow you to grow plants at home. It's not that way in Tracy. So you have to, and the rules of that all over the state are different from county to county. So you have to be aware of the rules. You can find the rules at the dispensary closest to your home, and if they sell plants there, then that's the place to start talking to them about growing plants. But if you do grow plants at home, I want you to be aware that in 2 patients out of the first 2,500 patients that I interviewed, there were home invasion robberies. And those home invasion robberies consisted of people that just came in and all they wanted were the plants. So you have to be very careful about not sharing any information about your plants to anyone. I don't care if it's your grandmother living in Massachusetts. That kind of information is very difficult to contain. So I don't want any of my patients talking about marijuana. Even if I ask you, are you growing plants? You definitely just say no, no, no. Okay, if you have to take a urine drug test in order to get a job, this is very common. Many people say, well, why would companies not want people to smoke marijuana? Well, I always give them the example, would you want the airline pilot of Air Force One to be doing a blunt in the cockpit before he's taking off? One patient asked me, well, I don't care what he does on his home time, but the guy, the pilot for Air Force One, is on call 24/7. So you don't really want him using marijuana. And many companies don't want people using marijuana, so I say you got to be aware of that. So if you ever are faced with a urine drug test in order to get a job, this is what you need to do. You need to stop all marijuana products for a month, at least a month. And then you start testing yourself with a test kit you get from Walgreens, CVS, Walmart, or Target. And if you're testing negative at home, you should test negative at the office. Please make sure that that test kit is not expired, and make sure it's a product made in America. Okay, the last thing I want to talk about is edibles. Edibles are fantastic. They don't have an odor. That you can work them into a routine. You can get a precise dose every time, and it's very convenient. Edibles are convenient, but there's a difference between eating marijuana and smoking marijuana. When we smoke marijuana, we get off in 20 seconds. When we eat marijuana, it takes an hour. So be very careful not to overdose. The 4 out of the 4 patients I talked to this last year told me that they overdosed when they got edibles the first time, and it was horrible. One of them, all they had to do was crawl to bed. The other 3 were throwing up. One of them for 2 hours, one of them for all night, and one of them for a day and a half before they were able to actually fall asleep. Marijuana, when you eat it, is a very precise thing. The people at the dispensaries know what they're doing when it comes to edibles. So if they tell you that you're going to eat just a quarter of this cookie, you believe them, because after an hour after you've eaten that quarter of that cookie, it's going to be a really good dose, man. And the other problem with edibles is if a dog, a cat, or a tiny human being gets to your edibles. So I say keep it locked up in grandpa's old gold coins, unlock it, open it up, take out what you're going to eat it right then, lock it back up. So welcome to our clinic. Thanks.